What is high-functioning depression? Depression is the most common mental illness in the developed countries. Low-grade mood disorders can be dangerous. A high-functioning depression may be the most elusive. For many people, this debilitating mood disorder can be suppressed enough to carry out daily work and responsibilities. What happens to a person who lives in the shadow of depression or anxiety? Depression that still allows a person to live a high-functioning life can seem like a deceiving term. That is why it is more often referred to as low-grade depression. Chronic depression, also known as dysthymia, can cause decreased or increased appetite, decreased or increased sleep, fatigue and low energy, lack of productivity, feelings of hopelessness, and low self-esteem. According to Harvard School of Public Health, chronic low-level depression can last an average of 5 years in adults or 1 to 2 years in children and teens. It does not completely cripple a person, but can hinder her ability to live life to its fullest. Losing zealous enthusiasm for work, school, family, and social activities can make life bleak, which often leads to episodes of major depression in 75% of cases. Because of the high risk of major depressive episodes, those who have low-grade depression should seek immediate treatment at the first sign of an issue. Though it is difficult to unmask this disorder, it often presents itself as a string of bad days or feeling low throughout a season or semester. Teens and adults who can pull off a normal-seeming life in public, yet suffer in private, eventually succumb to the pressures of success. Even those in their closest circles have no idea they are experiencing depression. Because depression and anxiety have distinct symptoms, like dropping grades, performance, or mood, those who are high-functioning can often mask themselves and pretend like everything is okay. But in reality, it is quite the opposite. The stereotypical picture of depression and anxiety limits people from identifying those at risk, and makes it difficult for those suffering to identify it themselves. By opening up communication lines through routine check-ins with friends and family, it can be easier to spot those who are quietly suffering but may not be exhibiting the typical symptoms of depression and anxiety. According to the Anxiety-Depression Association of America, anxiety disorders are highly treatable. However, roughly 1/3 receive treatment. No matter how many times we are reminded that mental illness does not discriminate, we revert back to a narrow idea of how it should manifest, and that is dangerous. Thank you.